Welcome back to TV5 News at 9. Joining us this morning is Dr. Hisham Gayard. He's from the McLaren Proton Therapy Center. So today we are talking about pancreatic cancer. And Dr. Gayard, we thank you so much for being here with us this morning.
It's my pleasure to be with you.
Yes, thank you. So more than 64,000 people will find out that they have pancreatic cancer this year, and nearly 51,000 people will die from that disease. So why is pancreatic cancer so deadly?
It is a significantly deadly tumor because of, unfortunately, the natural history of the disease. Some cancers are more aggressive than others. It's also because of the location of the tumor being surrounded by the bowel, the stomach, the kidney, the liver, very critical area of the body. The intestine is surrounding it. So the other reason is by the time we discover it, unfortunately, sometimes it's late in the game. So the best outcome for patients with pancreatic cancer when they are treated early with either surgery, and if surgery is questionable, radiation can help make the surgery feasible, or treat when surgery is not feasible. And there, proton therapy is a better treatment.
So Dr. Gayard, you talk about being able to treat that early. What are some warning signs that people should be aware of?
Sometimes it's mild, like pain in the upper part of the abdomen on the right side, next to midline. Sometimes it is in the advanced stages, it's jaundice. There is this color, the yellow color of the eyes and the skin, that the doctors would realize the seriousness of it. And that's because of backup of the pancreatic juices and the liver juices and going back in the blood. But that's a late sign. So unfortunately, the early cancer is often discovered accidentally or incidentally when we are looking for something else and we see a mass. So any symptoms in the upper abdomen, significant pain, indigestion, see your doctor. Maybe they will do a test that discovers it early.
And Dr. McLaren Proton Therapy Center can treat these cancers. So why is proton therapy a good treatment option for pancreatic cancer versus traditional radiation cancer?
Proton therapy is a particular type of radiation that it's a subatomic particles that stop at the target versus conventional radiation goes through. So even if we use multiple beams of conventional radiation, there's a lot of spill out radiation to normal tissue that makes the patient sick, depending on the site. And in this particular site or location for pancreatic cancer, it's surrounded by many sensitive organs. So damage to those organs is avoided when you use proton therapy. Let me show you an example, if you don't mind. I'll share my screen. So here you see the area that is in red is the target where the pancreas is. And you can see surrounding it is the kidneys to the right and the left, the spine and the spinal cord behind, and the bowels surrounding the area. Proton therapy, we can put the beam and it stops at the target, so the rest of the body is avoided. This allows us to give higher doses safely, allows us to treat without sickness, allows us to give the radiation together with chemotherapy, and with the patient tolerating the course of treatment better. So because of the protons being a localized form of treatment, it helps reduce side effects, enable us to treat sometimes if chemotherapy is given, while it's not the case with photons or maybe difficult then, and allows the patients to complete the course safely with less quality of life problems and side effects afterwards. So it is definitely a better treatment for pancreatic cancer than conventional radiation because of the physics of it. It's basically radiation that stops at the target. So it avoids 70% of unnecessary radiation to the surrounding organs. And with pancreatic cancer, those organs are very sensitive, and there's quite a few of them.
Yeah, and those are your vital organs. A lot of them are too, right?
Yes, absolutely.
Yeah. And Dr. Gayard, so if someone, they feel like they're experiencing some of the symptoms that you described, or they're newly diagnosed and they're exploring their options, how can they get in touch with McLaren Proton Therapy Center?
For any type, when radiation, first, when you have the diagnosis of a serious cancer like pancreatic cancer or others, there is it behooves you as a patient or family to seek, because sometimes physicians will tell you what they have available, and you may not hear about proton therapy if that's not accessible to your system or the hospital you're going to. So ask or call us, let us know and ask us, how can we learn? Is proton therapy good for me? Get in the website, and that is mclaren.org, proton/proton therapy, or call us 855-MY-PROTON or 855-697686, and we'll be glad to answer. You don't need to come. We'll check your factors. We'll have the doctor look at your data. We'll tell you if you need to come for a visit. And sometimes we can even see you remotely by telehealth. Now we can video conference, ask about details, and only if it's necessary, one can need to come down for treatment. And we'll advise you if this is a good treatment for you. And this is not only for pancreatic cancer. Many cancers, esophagus cancer, for example, we can treat the esophagus cancer and avoid the heart. Breast cancer on the left side, we can treat the left breast and no radiation going to the heart, while it cannot be prevented in most of the cases when we're treating with photon therapy, with the conventional radiation. So if you have cancer and radiation is part of the game or could be, ask yourself or ask us, is proton therapy a good treatment for me? And we'd be glad to help.
And Dr. Gayar, this just really sounds like it's some life-changing treatments and cancer therapy, right?
Yes, absolutely. It is. We have seen patients that did not believe, or they were told that they're going to not make it, and they're alive and they're happy. And some patients, like I have a patient who was told she's going to lose her left eye, and we treated that tumor. And not only that, she retains the eye with no change in her vision, complete cure of the cancer. She looks beautiful afterwards. So those examples, proton therapy shines, especially when it's close to critical organ in the body.
That is amazing. Well, Dr. Gayar, we thank you so much for spending some time with us and telling us all we need to know about this treatment and pancreatic cancer.
Thank you. Thank you for inviting me.
Yes, thank you so much. All right, so for more information, all you have to do is go to the hot link section of WNEM.com.